Today on Fluorosis Files with Mama Maji, we are at Parkview Dental Center. Let's hear what Dr. Catherine Maundu has to say about dental fluorosis.
My name is Dr. Kate Maundu. I'm a dental specialist prosthodontist. I have a passion for dentistry, and most of my work is around cosmetic dentistry, and therefore dental fluorosis is very important to me because I like making people look nice. So when I was pregnant, I coincidentally bought a new house, so I moved my young family to that house. So as a dentist, I know that I need to test the water levels just before the water is consumed. And this includes for the drinking water, the drinking water, the cooking water, and even for children, the water, like I had an infant at that time, the water that we used to mix the formula. Surprisingly, dental fluorosis has become endemic, especially in areas in Nairobi, parts of Rift Valley, and a bigger place, because currently we are depending on borehole water heavily to be used for drinking and for cooking and all that. So the other thing is the prevalence of dental fluorosis currently is around 40%, and 40% for any, it's a lot. So the interesting bit is when I took the water for testing at Riverside Defluoridation at Maji's place, we found that the water had very high levels of fluoride, which was around 8 mg, which I mean it's too much. So we had to install a water filter so that at least that brings the level of fluoride in that water to the recommended rate, which is between 0.5 and 1 mg per liter, yes. So high fluoride levels affect the mineralization of teeth, and this is more from the age of 0, and this is when the mother is pregnant up to 2 years old, because at this point is when the critical enamel and dentin formation is taking place. And for this, it's important at that time for the pregnant mother and even for the child to use water that is safe, that's within the recommended rates, because even the water that we use for mixing formula, it has to be water that has been checked, because if it's not, subsequently it affects the teeth mineralization process. So the other way of preventing this is, normally I know right now it's really difficult to harvest rainwater, but in places that it's possible to, I think policymakers or the government should actually kind of ensure that at least we harvest heavily rainwater to supplement the borehole water, even if we only harvest this for drinking and for cooking purposes. So the impact of dental fluorosis to the teeth, and sometimes it can also affect the skeleton, especially, this is the bones, especially if the water fluoride levels are too high. So there are ways of grading, and there are scores, and basically it's mild, moderate, and severe. So in mild dental fluorosis, the teeth will just have a cloudy appearance. They'll not have pits, they'll not have discoloration, but it will be there. Then on moderate fluorosis, we'll have some bit of browning, some bit of enamel chipping, and it's called mottling. Then on severe dental fluorosis, here at this point, we have tooth surface loss. The teeth are brown, we have no enamel, and sometimes the teeth have severe sensitivity. If you have brown teeth, that means, number one, your self-esteem goes down. Number two, aesthetics, how you perceive yourself. Because teeth contribute to the general beauty or how people look at you. So number one, it affects self-esteem, especially for children. I've had kids who are bullied or picked on because you have brown teeth. So the other issue, the other impact of dental fluorosis is the cost, because number one, treating that tooth is not permanent. It's not the same as having a normal natural tooth. I know as dentists, we feel nice when patients bring us money and pay us for treatment done, but really we have to look at it from the lifetime effect of the cost of this dental fluorosis. That's to the person, and number 2, to the country, and number 3, the bigger picture in healthcare, because it's becoming really expensive to take care of dental fluorosis. Because when you go to the public hospital, for example, to do masking on a tooth, it will range between 1,500 to around 3,000, and that's per tooth. So multiply that to the number of teeth that are affected. And then the other thing is, if you come to the private sector, the cost of being masking will range between 5,000 to almost 20,000 per tooth, depending on the dentist and depending on how severe this is. If I was not a prosthodontist, if I was not a dentist, I'd be in the beauty industry. I know how to make hair, I know how to do makeup, I know how to... Actually, when I was in campus, that was my side hustle for a very long time. Together for fluorosis-free future.